Hello, I'm Christina Makowiecka and I'm the lead of the Ideas Technical Resource Centre. This is the next in our series of videos that look at recent developments in maternal and newborn health. I'm very pleased to have Tanya Marchant with us. Tanya, welcome. Tanya attended a meeting earlier this year in Kirkland, USA, and she's come to talk to us about it. So, Tanya, could you tell us why the meeting took place?
Yeah, thanks, Christina. So I think it really took place because of lessons learned in the Millennium Development Goals. We learnt that we can substantially increase child survival if we can deliver the right life-saving interventions. So, for example, immunisation coverage increased substantially during the period 2000 to 2015, and millions of children were saved as a result. And it's been recognised that one of the key ingredients for that success was measurement, just counting, being absolutely determined to count the number of vaccinations that every child everywhere received. But we've also learned that we were not as good at counting in other areas. So, for example, around the interventions that are delivered in childbirth and the interventions that are delivered to sick children. We still need to improve our measurement and evaluation approaches in these two areas in particular. So the Kirkland meeting, Kirkland's a lovely town just outside Seattle, was a group of people brought together from the global measurement and evaluation community to talk about these issues and see if we couldn't define some principles to guide our thinking going forward.
Okay, and what were those principles?
Well, so we spent 2 days talking things over. We were quite a broad community, from funders to researchers to program managers to implementers. So a lot of different interests being represented, but we did find that there were 5 common themes that we all shared. So the first principle was the importance of focus. At this moment of transition from the Millennium Development Goals to the Sustainable Development Goals, it's a moment where there are quite a large number of individual programs writing indicator lists, which is incredibly important. But what we've lost at the end of Countdown is that sense of a shared agenda for measurement across the life course. So we felt that it was really important to bring that to the fore, to have a focus of core indicators that link the lists, don't replace them, but that link the lists so that something is represented right across the continuum. And then the second principle was around relevance. So the principle of focus is speaking mainly at the global level, also at the national level. And it's about accountability, it's about getting investment, it's about tracking. But countries need data that's actionable, that's relevant to them to improve their own programs. At 2 levels, we need to be more granular in the data so that we've got data at district levels and also at facility levels so that people can improve, they know their own performance and can improve as they proceed. And so data needs to be more timely. We need to move beyond the stage of waiting for 5 years to find out if something was having the desired effect or not. So yeah, data becoming more relevant, more timely, more granular, more actionable. Linked to that, the third principle was one of innovation. So how are we going to get this more relevant data? We need innovations in data capture. Digital data capture innovations are taking off more and more beyond just at the project level now. We've got governments using digital data capture methods for facility level records, for example. And this is really exciting and we need to see more innovation here. But also innovations in methods. So we have our household surveys that continue to be crucial to provide us with population level estimates, but that we've seen don't always provide us with the information we need, especially care around childbirth and care for sick children. There have been some reliability studies that have shown us that caregivers aren't always able to report reliably on those things. So then we have our facility data streams that can provide us information about clinical evidence, but can't provide us with the population level balance. So we need innovations in the methods to bring the data streams together so that we can generate some clever, effective coverage measures. So the fourth principle was equity. Equity's always been important, but now more than ever, it needs to be purposefully planned for in programs and planned for in measurement. We need to invest in measurement in ways that allow us to power our studies so that we can confidently report on outcomes for all the different subgroups. If we're ever going to reach universal coverage, we need to know whether or not things are reaching all of the different subgroups, including the most marginalised. And the last principle was one of leadership. We desperately need leadership to pull these streams together, to provide country focus, country-led capacity, and to pull together the initiatives of country partners so that collectively we can have a bigger impact through measurement and evaluation.
So you agreed those principles,
yeah.
And then what are the next steps?
Well, I mean, it's actually a very exciting time, I think, in measurement for maternal, newborn and child health, and with adolescent health being, purposefully brought to the fore as well. I think given increases in country capacity and country ownership, and from the countdown, the leadership that Countdown presented us with, there's never been more data than there is today in maternal, newborn, child health. And we want to see that momentum continued. I think that one of the priorities for today is to be very clear about what it is that we know we're good at measuring, that tracks into our history, that we've already got historical data for, and that can be mapped into the future. And to start today to make sure that that measurement continues. But then also be very clear about our aspirations for measurement, and to have a programme of work that's invested in and supported so that tomorrow we measure more of the things that we know could save lives.
Thank you, Tanya. Thanks very much indeed. If you'd like to read about the work of the Kirkland Group, then it's been published, a paper's been published in the Lancet, and we give you the URL for that. Also, if there's any other subject in maternal and newborn health that you'd like us to bring up in one of these videos, then please let us know. Thanks very much.